Welcome to Pharmajosh YouTube channels. Today I would like to discuss about the parathyroid glands. So first off, we should know the locations of the thyroids and parathyroid gland. Here you can see this is the larynx portion. This is the trachea is there. Just above the trachea, here we found our thyroid gland. Here in these sides view, here this is the thyroid gland. In these thyroid gland at exactly back sides of, this is the front view of the thyroid gland, this is the back views of the thyroid gland. Here you can see this is the yellow color that indicated, this is the two pairs, that means 4 number of the parathyroid gland. Those they are found here 1, 2, 3 and 4. So this is the locations of parathyroid gland. Here you can see this is the parathyroid gland on the back side of the thyroid gland. First off, the location of thyroid gland. The parathyroid glands are the two pair of the small oval shaped gland is there. Here this is the two pairs and oval shaped gland is there. They are located next to the two thyroid gland lobes in the neck. Here we have two lobes for the thyroid gland is there. Here in that lobes we found the parathyroid gland. Each gland is usually about the size of the pea, just only pea size we found our parathyroid gland. Parathyroid glands and hormones. The parathyroid gland produces the parathyroid hormones, which plays a key role in the regulations of the calcium level in the blood. So these things you must be remember. Parathyroid hormones is released from the parathyroid gland and its main function is the regulations of the calcium in the blood. So here that indicated properly, this is the locations of the parathyroid gland into the thyroid area. Functions of the parathyroid gland. Calcium is released from the bones and into the bloodstream. Absorptions of the calcium from the food via the intestinal tract. Calcium storage accomplished via the kidney. So this is the main three functions of the parathyroid gland. If the low concentrations of the calcium is found into our blood, that release the parathyroid hormones. These parathyroid hormones that influx of the calcium from the deposited calcium from bones into the blood circulation system. Secondary functions of the parathyroid hormones in the kidney that decrease the loss of the calcium into the urine. Due to these that increase the calcium level into our blood circulatory system. And third things in the intestine enhance the absorption of the calcium from the intestines with the help of the vitamin D. So this is the three main functions of the parathyroid hormones. Those you must be remember, and then increase the concentrations of the calcium in the blood we found. The regulatory mechanisms of the calcium level into our blood circulatory system by the two main hormones. First one, this is the thyroids and parathyroid gland that release hormones. First of the calcium homeostasis of the blood at 9 to 11 milligram per 100 ml. This is the normal level of the calcium. But due to any XYZ reason, the falling blood calcium level, due to this condition, we can say this imbalances of the calcium. Due to these, our thyroid gland, those having parathyroid gland that released parathyroid releasing hormone, means the parathyroid hormone. These parathyroid hormone, shortly we can say this is the PTZ. PTZ, this produce the calciums from the bones by the osteoclast degrade bonds. matrix and release the calcium into the blood circulation. Due to these, calcium level are that become maintained into our blood circulatory system. But in some cases, the rising of the calcium level into the blood during those time, our thyroid gland that release the one varieties of the hormones, that name is the calcitonin, and these calcitonins that stimulate the calcium salt deposit into the bones, and once again the normal range of the calcium we found into our blood circulatory system. This is the process for homeostatic mechanism of the calciums by the calcitonin as well as the parathyroid hormones. Deficiency of these hormones that produce some disease of the parathyroid gland. This is the hyperparathyroidism due to the increase the parathyroid hormones, increase the calcium hormones, and decrease the phosphorus. Hypothyroidism or the renal disease is due to the decrease the parathyroid hormone, decrease the calcium levels, and increase the phosphorus levels. Secondary hyperparathyroidism is due to the increase the parathyroid hormone, decrease the calciums and increase the phosphorus. So this is the short introductions about the parathyroid gland. Thank you very much for watching Pharma Josh YouTube channel.